Though, I wanted to tell you about, there's some new analysis about young people's experience of mental health services. And what it has found is that where young people have had connection to or involvement with social care, that they will find it much more difficult to access mental health services. And I wanted to take a closer look at this, and we're joined now by Dustin Hutchinson, who is Senior Policy, Public Affairs and Development Manager at the National Children's Bureau, where this research was conducted, and also Jack Smith, who's co-author of this report and has lived experience of children's social care and mental health services. Coming to you first, Dustin, can you please just talk us through what this latest analysis has shown?
Yes, absolutely. Happy to, Natasha. Nice to meet you. So just to tell you a bit about National Children's Bureau, where we're from, we're a leading children's charity with over 60 years of experience in championing children's rights and welfare. And we do research across all areas of childhood, including social care and mental health, and use our evidence to advocate for systems change. And that's what we're doing here with this research. This research is created by a partnership between National Children's Bureau and University of Cambridge, and the findings are quite striking. The research found children and young people with social workers are 3 times more likely to be rejected by child and adolescent mental health services than their peers, although they're more likely to suffer from poor mental health. And the research found young people often get rejected because their social situation is viewed as not stable enough, but sometimes that's what's causing or worsening their mental health issues. And we found children and young people are rejected when their needs are perceived as too complex or resource intensive, and due to their situation, for example, they're struggling because their placement's breaking down or they feel unsafe at school or at home, they can be rejected from mental health services. And so it's perceived that they need to be in a stable situation to benefit from mental health support, which isn't the case. So some of the most vulnerable children are not getting the mental health support they need.
So it's almost the people who need it most who are being denied that care.
Absolutely, the most vulnerable, yeah.
Why do we think that this is happening? Is it because ultimately of austerity and services being overstretched? So, I mean, I don't want to cast aspersions, obviously, on anybody who works in children's mental health services, because I know that they're doing their absolute best. But it does feel a bit like it's almost looking for an excuse not to take on more people to what is probably already a very long waiting list.
Yes, absolutely. With austerity, there has been huge cuts to services. Undoubtedly, the mental health practitioners are doing a great job and doing their very best. But there seems to be an implicit assumption that children need to be in a stable social environment to benefit from mental health support, and that's not actually the case. And it's meaning children in unstable situations aren't getting the mental health support they so desperately need.
Jack Smith, co-author of this report with lived experience of children's social care and mental health services, who I mentioned earlier. Welcome to the programme. Can you tell us a little bit about your story?
Yeah. Thank you very much for having us on. So I was taken into care at the age of 4 and lived in a variety of placements, including foster care and residential. And when I was 14, I had a very serious mental health crisis. Basically had a psychotic episode as a result of kind of dealing with an abusive home life, with my foster parents kind of being quite abusive, but also dealing with kind of like amateur attempts of conversion therapy because I'm also transgender. So it led me to have like a massive breakdown, and my experience of mental health services was like on a different planet to what is now for young people. So for example, I got seen same day on the Monday when I presented to A&E in a crisis, which just wouldn't happen nowadays for young people. And then by the Friday, I was in a hospital with a bed, safe environment, and had wraparound support and had everything I kind of needed to put me on the journey to recovery. And nowadays, like, young people are being turned away from A&E. CAMHS are turning around saying like they don't have the resources, and there's like really long waiting lists, like not just weeks or months, but sometimes years for some young people. And it's like when they're turning around and saying things like, "Oh, you're not stable," well, obviously, I'm not going to present to A&E and say, "Hi, I'm feeling really stable. So treat me." They're not going to do that. The whole point, or like kind of definition of being unwell, is that you're unstable in a way. And it really does make me feel really sad for young people who are in the care system now, especially because it's like I got seen really quickly, and this was back like years ago, because I'm an OAP now, basically.
If you are an OAP, I don't know what that makes me, Jack.
But yeah, it just proper it really hurts to see kids in care who are like the most vulnerable people, who don't have parents to advocate for us, and like our ultimate corporate parent, is the phrase they use, is the government. And it feels like we just get statements and speeches, and I'm like, we need direct action now. Like, I believe there is a proper pandemic with mental health services, and children and young people are in particular most at risk, basically.
So what do you make of this argument, if you think back to your own experiences and being in an unstable environment, that the services, presumably therapeutic mainly care, just wouldn't have worked on you at that time because you didn't have the stability to underlie that?
Well, yeah, so for example, when I got into hospital, I'd ran away and I didn't want to go home to my foster placement because it was so abusive. They wouldn't have gone, "Oh yeah, let's put you in a therapeutic kids home," because that costs a lot of money. So they would have put me in foster placement and foster placement and foster placement until I would have broken them all down, and then I would have ended up in a residential after weeks or months or years of more trauma. Whereas when they put me in hospital and then later into a therapeutic kids home, it kind of was the right order of things, instead of adding more trauma, if that makes sense. And I feel like young people now are having to sit with their trauma, and then it escalates to the point where they're self-harming more, they're making more serious suicide attempts, they're going through more crisis. And it's like, if you rock up to A&E and you've grazed your knee, it's a simple thing to do. But if you rock up to A&E and that graze has got infected and you've got sepsis, it's the same sort of thing with mental health, that if you should treat kind of earlier on as much as possible, not just because it's the right thing to do, but the taxpayer has to foot the bill, and it's thousands of pounds to keep someone in hospital for mental health placement. Whereas if you could treat that sooner and not say, "Oh, you're too unstable," if you address their issues and kind of treat them where they're at, I think that could be really beneficial to young people and obviously the taxpayer.
Thank you so much, both of you, Dustin and Jack, for talking us through the findings in that research from the National Children's Bureau, and also Jack for sharing your story as well. Thank you to both of you.